Thank you very much indeed for inviting me today to this meeting. I joined the last COVID meeting as well and found it absolutely fascinating, and certainly as from DEFRA's point of view, we're very supportive of this whole programme, and the quality of the talks that have been on today, I think, do show why it is such an important way of approaching this kind of issue. Of course, the quality is about to go down right now, isn't it? But anyway, so I have a slightly unusual job in DEFRA in that I am a scientist, but I also have a policy role. There are only about 3 or 4 of us who have that joint role. Normally you have to do one thing or the other. So luckily I get to do both, and my policy areas are, as Lisa said, the new emerging diseases, wildlife diseases, horses, pets, anything that's essentially not livestock. But then I have the risk and the science and research portfolio for all the other exotic notifiable diseases. I'm very lucky that I'm the chair of HARES. I took over from Dilys Morgan, and I'm sure many of you on this call will know Dilys well, and very big shoes to fill, I have to say, but it's a thoroughly enjoyable part of my work. And I'm also on the EFSA Animal Health and Welfare panel. Despite Brexit, a few of us have been invited back to join the EFSA panels, where we're providing advice not on behalf of our countries, but simply from the knowledge that we have in various areas. And recently was on the OIE working group on safe trade for COVID-19. So we were looking very closely at the mink problem and whether we should still be trading mink fur around the world. I have to say I learned more about mink fur farming than I ever intended to do, but a fascinating area. So what I wanted to talk to you today about is some of the issues that we've come up with or come up against during COVID, but I mean, actually COVID has just focused it really, but we've always had these problems in the past about how you deliver science-based policy and how you get politicians in particular to listen to you, and also how you work across multiple disciplines in order to deliver some of that policy where it's so cross-cutting across the different government departments in particular. And one of the things that we have been doing is looking very closely at One Health across government, because I would say, and I don't think it's unreasonable to say it, that we weren't terribly good at this beforehand. And particularly, we didn't even know who some of the other people were working in these different areas and different government departments. So we have been looking now at what actually defining it again, because there are multiple definitions out there. And of course, because we're government, we couldn't really decide on what it was in the end. So we went for 2 different strands to it, about the concept of it being the health of humans, animals, plants, the environment, and then how you work together to bring all of those different multiple disciplines together. I've stolen this diagram from a paper by Piggott et al. In the Lancet looking at emerging disease hotspots, which is a fascinating paper, but I just find it a very useful diagram, particularly when explaining the concept of a pandemic to ministers, because you can show them why it jumps up a level at each stage, that you've got the wildlife, human-animal interface, then how does that index case not get diagnosed in time that they can then pass it on to somebody else? And then those people start to travel and suddenly you've got a global pandemic starting. And it's amazing how pictorially people suddenly, particularly ministers, start to pay attention to these things when they can see it like that. So onto the HARES group itself. So with the Human Animal Infections and Risk Surveillance Group, it started in 2003, and we involve members from a range of different agencies across the UK. We have recently expanded to include the Crown Dependencies and the Republic of Ireland. We've all got close working relationships, professional contacts, collaborators and networks. And we often say, in fact, well, it was mainly Dilys who told me to remember this, that whoever asks to be on HARES probably shouldn't be on HARES. It's a little bit like the is it Groucho Marx about joining a different gentleman's club, because we don't want people to come along with their own egos. It's a very free-flowing conversation, hopefully, And we just provide a multidisciplinary focal point. So as the chair, I'm not necessarily, and certainly not the expert in these areas, but hopefully we can draw it out of all the rest of the team when we're asking particular questions of them and working on different areas. And we do focus on the non-foodborne zoonotic diseases, because there are other groups that work on the foodborne zoonotic diseases and or just foodborne disease and so on. So, and there's entire groups that work on antimicrobial resistance, for example, but also on influenza. So we don't tend to talk about those too much. But the priority for One Health in the UK, I think now it's interesting that Tony mentioned BSE and the story of BSE and how a lot of work came out of that, because of course what we want to try and avoid is that veterinarians should never make comments about the risk to public health, and medics should never make comments about the risk to animal health. And there was a lot came out of the lessons learned that maybe there was mission creep happening throughout the BSE crisis. So you have to have your expertise acknowledged in those different areas, and you have to be able to do the risk assessments and risk communication where you are trusted by the public, or else you'll have a big problem on your hand. So in terms of COVID, where are we now? Well, COVID's not going anywhere, certainly. So we still have a lot of work to do in this area. We have, because of hares, we've got that interaction between animal health, public health, and food safety as well. So still understanding the source of COVID, we need to do that to find out what the next one will be. And although we can come up with lots of black swan definitions of where we think the next great threat will come from, and we can, the joy of working in a multidisciplinary team is that you can come up with quite strange and wonderful ideas for what the next threat will be. But we need to understand what was the behavior that drove this, what was happening right at the beginning of it all. Was it contact with wild animals through caving with bats, or was it fur farming and so on? And finding those reservoir populations. Again, we've got to continue to do this and look for them, because it could impact on our vaccine, diagnostics and therapeutics plans for what's happening at the moment. Biodiversity, let's bring back the environment into One Health as well, thinking about biodiversity, conservation of rare species, of wildlife. We have been coming up with a lot of recommendations for wildlife carers, people working generally with wild animals. And we need to have those in place also for some of the more common diseases that we've got. We've got avian influenza at the moment. In this country, we're expecting a long drawn out season as we had last time. And we had a lot of rescue centres where people think they're doing the right thing by rescuing sick and dying water birds, particularly swans, and are then putting themselves at risk of potentially contracting avian influenza from them. And we also want to try and avoid unnecessary concerns about food. We remember the Seladike swan, the H5N1 swan back in 2006, I think it was, in Scotland. Many people throwing out their frozen poultry from their freezers, and we still want to make sure that people are handling animals in a safe way, but let's be proportionate and, if necessary, precautionary. So the OIE is publishing the regular maps on the animal cases. As you can see from that, there's some very large gaps. I mean, if nothing else, this tells you which countries are looking for it. And I strongly suspect if you look for it, you'll find it wherever you are. So these countries do tend to have a greater level of surveillance, which is important to understand that, because those gaps are probably where you want to focus work a little bit more. So some of the big international groups that are setting up, and this one being the perfect example of it, where you've got people in these different regions that can bring some of this information together. That's why this sort of program is so important. So how do we do our assessments? Well, within our multidisciplinary group, we undertake, first of all, an assessment where we think we could do the full risk assessment, or just a risk statement where we need to do it. If the evidence is a bit poor, but we still need to raise awareness, we'll be doing risk statements. The assessments themselves, we look at the human exposure to an infected animal. So we're often interested in the behavior of people. And we've also realized that as we were doing one for the Mustelinae, so wild mink, polecats, etc., for SARS-CoV-2, we've also now added in some questions about whether we should be considering a mutation event in that assessment. And of course, if we're looking at animals destined for the food chain, we need to consider animal-to-animal exposure, animal-to-human exposure, and then consumption of animals as separate assessments, because they all have different processes and different methodologies as well. So we've done several assessments during the COVID pandemic. The first one we did was on pets, looking at dogs and cats and ferrets and realizing they were quite likely to be infected from contact with humans. And that led to us doing some work with care homes to try and tell them not to take pets into care homes. It's surprising how many care homes take them in there for the comfort of the people who are in there. And we also developed then with Sharon, and Sharon mentioned hers earlier on actually, but with Sharon's lab with the diagnostic protocol for animals. We did one on livestock and came to the conclusion that if any were going to be infected, it would be more likely to be pigs because of the similarity in receptors. But we actually didn't check deer at that time because we don't really think of them so much as livestock as the other animals. The Mustelinae one, as I mentioned, we were looking at the mink cases and then trying to work out what was happening in this country. And as a result of that, we've done a lot of work on people keeping ferrets and the surprising number of people who keep ferrets and how they actually send them to shows and do all sorts of things like that. Mustelidae, now we've expanded it to cover badgers. So we're doing guidance for wildlife workers, TB vaccinators, etc. And the deer population. So after all the cases that have happened in the States in the white-tailed deer, we are now starting a risk assessment looking at that exposure back to people through consumption, because we've got quite different deer species in this country, but they're still very important. And then I just wanted to mention finally, one of the assessments that we've done on rodents. Quite a few of the authors are on this call as well. But this I think was most interesting because we actually brought in the environmental side in a One Health way by looking at wastewater, as well as the animal health risk and the public health risk, and bringing all of these back to SAGE so that they can also sign them off, which was an important part of the whole government response to this. So it was a very quick rush through some of the work we do at HES, and most of it is on our website. If you go to gov.uk and look for HES and PHE. In conclusion though, please, one of the things we always think about carefully is how you communicate who is making all of these different assessments, because to maintain public confidence and political confidence as well in what we do, you have to have the right experts. Behavioural science is becoming a real area of interest for us to make sure that we pull people along and don't push people along in terms of what they're doing, and certainly making sure that people are recognising and understanding that health aspects to it. And finally, One Health is not one-sided health. This was my complaint right from the beginning. We, in the animal health side, have dealt with huge outbreaks before, and yet nobody came to ask us at the beginning of this what we should be doing. Track and trace, vaccination, movement controls, all these sorts of things that as animal health specialists we do. We don't just go out there and cull everything. So hopefully, if nothing else, it will have brought the vets back in. Thank you very much.